Hi, I'm Dave Harris from Evergreen Regenerative Medicine and Rehabilitation. Thank you for tuning in. If you've watched any of my other videos, you'll remember that we've talked previously about some regenerative medicine techniques, some of their history, some of the theory behind how and why they work. And if you remember, last time we talked about PRP, or platelet-rich plasma. That's probably my favorite regenerative technique because it has such broad application for many different diseases and conditions. Today I wanted to talk a little bit and give an example of how the rubber hits the road with regards to PRP, and probably one of the most common diseases that we'll ever experience in our life. This disease is one of the most common diseases or conditions of aging. It's progressive, it's degenerative. Everybody knows of it or refers to it as osteoarthritis. Now, osteoarthritis is kind of a big deal because it affects almost everybody. We have an aging population. We continue to live longer and longer, so it's becoming much more prevalent throughout our population. Now, osteoarthritis doesn't just make us have a hard time walking. It affects many joints. Of course, the knee joint is one of the most common joints, but also the hips, the back, the hands, of course. And as it affects multiple joints, it becomes much more concerning in that it can cause quite a bit more limitation. What happens with osteoarthritis is the cartilage, the nice, cushiony, smooth, frictionless surface inside a joint, starts to get pitted and decayed or worn out. It becomes more rough and more creaky, and it does not do as good a job secreting the lotion or the lubricating fluid inside the knee or any joint. And so as we move or as we try to get around, our joints are much stiffer, they become more painful. As those pits try to fill in, or as our body tries to fix the defects, we start to get bone spurs which start to get in the way and further make things worse by decreasing range of motion and of course increasing the pain as well. So osteoarthritis is kind of a big deal. So for years and years, we've been looking for a way to find a treatment for it. So far, there's not one specific or proven treatment to alter the progression or stop arthritis once it develops. We're working really hard and we're making some good progress. What have we done so far? Well, if you just had some mild arthritis, there's a good chance your doctor would say, hey, we can treat this conservatively. What I need you to do is exercise every day, because we know that exercise stimulates the cartilage cells to secrete more of the lubricating lotion, that's called synovial fluid, that lives inside the joints. That will give you a better lubrication, less friction, and probably slow down the progression of the arthritis. We certainly know that it helps treat the symptoms of arthritis well. Now, the other thing that your doctor might tell you to do, of course, is diet, because we know that the heavier we are, the more load, the more friction, the more pressure there will be on the joints as we're trying to get around. And of course, that's going to be painful and most likely accelerate the progression of the disease. Well, that's easy. Easier said than done many times. It's not always easy to be consistent with a diet. It's not always easy to be consistent with exercise. But we do know that's the first and most likely one of the most important steps to controlling this disease. So let's say you've done that and you still have arthritis. Well, what next? Well, the next step would be, of course, medications or supplements, things like that. You may have been to a health store and seen something called glucosamine and chondroitin. That is a supplement, it's kind of a vitamin, if you will, that you can take that, in theory, does a good job of supporting the cartilage inside the joints and regrowing those tissues. It's kind of the building block that your cells might use to build up this synovial fluid or that lubricating lotion that lives inside the joint. Other medications, certainly we could try any of the NSAIDs or non-steroidal anti-inflammatory medications like ibuprofen or Aleve. They're beneficial, they could be helpful. They do have some side effects we have to be careful of, but we do know that they can decrease inflammation and that can slow down the progression of arthritis. We have to be careful that we don't have other medical conditions that these could actually aggravate or worsen, of course. And sometimes there's some drug interactions that we have to be careful of. If we didn't want to use those, we could try something like Tylenol, which will help mitigate the pain, kind of like the ibuprofen does, but is not likely going to slow down the progression. So let's say you've tried all of that nothing's working, you don't want to keep, well, you want to keep doing diet and exercise, but it's not really making a big difference. Medications aren't working or you can't tolerate them. Well, the next thing would be, well, what can I do that's minimally invasive? You might see a doctor, they might say, hey, we can try some injections inside your joint. That can help the joint be more healthy, could help it move better. And we have a few different kinds of injections in our arsenal that might be helpful. For years and years and years, we've tried corticosteroids or cortisone, which is a strong anti-inflammatory. We could inject that inside the joint. It'll shut down a lot of the inflammation and often makes you feel better. There are a lot of side effects with cortisone, so we try to be real picky or stingy with how often we use it. And there is some evidence that suggests maybe cortisone or the corticosteroids can accelerate some degeneration in some regards or some situations, and certainly has been shown to be unhealthy for some tissues. So we got to be careful with that. When the corticosteroids aren't working anymore, a lot of times the patient comes back and says, well, now what? What else can I do? And we've got this new medication. Well, it's not new anymore. In 1997, they released in the United States a medication called Synvisc. Synvisc was the first one of a family of, the overall family is called hyaluronic acid. What is hyaluronic acid? Well, basically it's the same thing as glucosamine that I was telling you could take by mouth before, but fancier. This one's got a high molecular weight. It's refined so they have only the biggest molecules or chains of the glucosamine. And it's so big, if you were to try to take it by mouth, it'd probably just get chopped up and wouldn't make it to where it needs to be inside your knee. But if we inject it in there, well, we know that glucosamine is one of the building blocks of this synovial fluid. And glucosamine does a really good job absorbing water, and it becomes thick, and it becomes a really good viscous surface lubricant that can do quite a bit of good in terms of helping to rebuild the cartilage and also to lubricate the joint. So Synvisc is a great option. It's a little bit expensive. Some patients have a bad reaction to it. Not everybody, and most patients do really well. It lasts usually about 6 months. Unfortunately, then you have to repeat that injection. Maybe if you're lucky, you'll get 12 months out of it. So they did this study where they looked at other treatment options. And of course, we were talking last time about PRP. How does it work? Well, PRP is known to stimulate migration of the mesenchymal stem cells, stem cells, that then when they migrate to the area where the PRP is signaling, come here, it also tells them, hey, start differentiating, make more, and also start propagating and proliferating, and then differentiate into these kinds of cells that we need inside the joint. Often it's cartilage cells, which is great because we're trying to resurface the joint where there's been damage to the cartilage. PRP also has been shown to decrease inflammation. So through this process of bringing stem cells along, decreasing inflammation, there's good evidence to show that PRP can start to heal joints, can start to heal cartilage and make progress in that regard. And that's one of the most exciting tools that we have in recent years that has been beneficial. So one of my favorite parts of being a doctor is the science. I love to read about it. I love to share with my patients and maybe present ideas or advice that might be beneficial to them. I didn't go into medicine to be a salesperson, and so I don't like to tell you, hey, this is what you need, or this is something that I think is great. I like to present the data and let my patients decide for themselves. So I found this really exciting article. It was a journal article released in 2020, which shows some amazing results, where they compared hyaluronic acid, which was the go-to treatment after all the other steroids and oral medications quit working. They compared that, which had been being used since 1997, to PRP, which is kind of a newcomer on the street. The results were amazing. I can't wait to tell you about it.